Hi everyone, my name is Mavi and my presentation is over the healthcare workforce shortage in the American Rescue Plan Act of 2021. So, the American Rescue Plan Act was signed in early 2021 to help combat issues caused by the pandemic, one being the struggles the healthcare workforce was facing and the shrinking of it. So, it provided funding to the healthcare workforce at the local, state, and federal level, and it had goals to recruit, train, and retain new healthcare workers, increase the number of clinicians caring for underserved populations, develop the behavioral health workforce, and create programs to better the health of healthcare workers themselves. Billions of dollars were allocated to healthcare from ARPA. For a little more context, the healthcare workforce has been shrinking due to a number of issues, including stress, burnout, harassment, and physical injury, which has led to a mental health crisis, as well as lack of funding, the pandemic itself, and the pandemic exacerbating existing issues. There's also challenges that have lasted for over 20 years, including a cycle of neglect, panic, repeat, where a major health crisis will occur, causing increased awareness, funding, and response. Then, once the issue is resolved, it's neglected again. There's also major recruitment problems, a lack of diversity, high employee turnover, labor market competition, and low wages. And these shortages are causing worsened patient outcomes. There's a lack of access to care, and care can be slow. This graphic shows that about 4 in 5 healthcare workers say they've been affected by shortage of medical professionals. As for analysis of how ARPA actually helped the healthcare workforce shortage, one population benefit that happened was that some healthcare facilities with ARPA grant funding reported a sense of enhanced worker voice, a changing culture, and increased awareness and utilization of mental and physical health resources. This helped not only healthcare workers, but patients too. It was also reported that there was new staff dedicated to leading wellness initiatives, and facilities were more focused on training and engaging leadership. As for cost benefit, ARPA funding didn't really keep costs down or show any cost reduction, but rather it provided the funds hospitals and other healthcare facilities needed to address many issues, including the worker shortage. Total good was maximized with the American Rescue Plan Act by many ARPA resources and funds being directly allocated to rural, underserved, and low-income communities who needed it most. Also, states were able to use ARPA funds to increase wages and improve working conditions. Funding was provided that helped fill critical staffing gaps in public health. However, there were concerns with that because many of the positions were temporary. As for how the policy was administered and regulated, the funds were approved by the U.S. federal government and given to hospitals or other health facilities by the Secretary of the Department of Health and Human Services. As for how the policy affected stakeholders, there's a study from the Commonwealth Fund published in 2024 which looked at the shortage of specifically direct care workers in 7 states, with ARPA funding being a major factor. 20 interviews were conducted from September to December 2023. People interviewed included community partners, state officials, provider organizations, and national aging and disability experts. State legislatures had authorized use of ARPA funds to increase provider payment rates and wages for direct care workers. ARPA funds gave an infrastructure boost, allowing states to invest in what was needed for workforce recruitment and retention. One state administrative official said there's no way we could have done what we've done without ARPA funding. Based on the analysis criteria, ARPA did help improve the healthcare workforce shortage. Grant funding led to health workers being more heard, and it gave them more wellness benefits. Hospitals and facilities got the money they needed to improve several facets, which led to worker attainment and retention, and states were able to better infrastructure. It's likely that the workforce shortage would be way worse today without ARPA. However, the American Rescue Plan Act was not a long-term solution. The funding is now running out and/or expiring, and key challenges in the health workforce still exist that are contributing to the shortage. So, what can be done? To address and improve the healthcare workforce shortage long-term, a multifaceted approach is needed. Changing and improving aspects within health systems, hospitals, and facilities themselves, as well as new legislation, is the best option. So, who benefits? Well, healthcare workers will gain better staffing levels, reduced burnout, and an improved work-life balance. Patients will benefit from increased access, shorter wait times, and improved outcomes. And health systems will benefit from lower turnover, lower costs, and improved quality metrics. As for cost benefits, investments such as funding for nursing programs, increased graduate medical education slots, and wellness programs will have high long-term returns to reduce turnover costs, fewer adverse events, and better patient outcomes. Also, technology integration such as telemedicine and workflow tools will reduce clinician workload and prevent burnout. As for increases in equity and fairness, increasing staff diversity and expanding access to internationally trained physicians will improve representation and cultural competence. Better staffing and expanded care access will help underserved communities that face the largest shortages. Also, loan forgiveness and flexible scheduling will create more equitable opportunities for lower income and minority workers. As for ease of administration and legislation, permanently increased public health budgets will allow for easier administration of these ideas and policies. Also, preventive public health programs will help ease administration, as the number of sick people won't be as high to begin with. These measures are all necessary and they go hand in hand. There are many issues that need to be addressed, and only fixing one issue won't make enough of an impact. And here are my references. And that is it. Thank you.